Hi, I'm Igor, and today we'll go talk about aortic dissection. Aortic dissection is a tear and widening of arterial internal layer, followed by blood entering vessel wall and causing pain. Typically affects aorta. Tear formed in tunica intima of the aorta leads to high pressure blood flow between tunica intima and tunica media and the separation of the layer, which lead to formation of false lumen and dilate aorta. Most aneurysms develop in the first 10 centimeters of aorta, can present acute and chronically. Types based on Stanford classification include type A and type B. Type A, dissection involve ascending aorta and or aortic arch, sometimes descending aorta. Type B Stanford classification is dissection involved descending aorta and aortic arch without involvement of ascending aorta. Causes is weakness in vessel wall due to chronic hypertension, blood vessel coarctation, and connective tissue disorder aneurysm. Based on the Beckey classification is type 1, type 2, and type 3. Type 1 involves the ascending and descending aorta, and type B involves the ascending aorta. Type 3 involves only the descending aorta. Stanford classification involves the aorta proximal to the origin of the left subclavian artery. And in type B involves the aorta distal to the origin of left subclavian artery. Risk factor for this disease is pregnancy, previous open heart surgery, vasculitis, trauma, family history of aortic dissection, and Turner syndrome, cocaine use. Cystic medial necrosis, familial inherited disorder causing degenerative breakdown of collagen, elastin, smooth muscle, wall weakness, predisposing individuals to aneurysm and dissection. Complication for this disease is pericardial tamponade, most common cause of death. Blood flow tears tunica media and tunica externa lead to severe internal bleeding and death. Blood flow tears tunica intima again return to true lumen, not severe. Obstruction of arterial branches of aorta leading to ischemia of individual organs. Blood tunnels create false lumen that extends of aortic branch leads to obstruction. And symptoms. Sudden intense tear and chest pain radiated to back, nausea, vomiting, diaphoresis, chronic dissection, painless, decreased peripheral pulses, asymmetric pulses, hypertension depending on location of dissection, diastolic decrescendo murmur, ascending aortic dissection, aortic regurgitation, neurological deficits, stroke, hemiplegia, and syncope. Diagnoses include chest X-ray widening of the mediastinum and consistent with dissection, but inadequate as sole evidence for diagnosis. Transesophageal echocardiogram best for hemodynamically unstable individuals. High sensitive for identified dissection for complication like aortic regurgitation, cardiac tamponade, involvement of coronary arteries, CT angiography. Best for hemodynamically stable individuals. High sensitive for identified dissection can provide anatomic information useful in planning surgical repair, visualize and locate dissection. ECG help rule out alternative diagnostics possibilities, for example, myocardial infarction. Treatment Stanford B, lower heart rate, blood pressure. First line beta blockers, second line calcium channel blockers. Pain management for acute dissection. Surgery. Stanford type A, medical emergency, surgical repair indicated. Type B, surgical repair indicated when dissection acute complication arise, medication ineffective. Thank you, subscribe to the channel.